Hello everyone. Today we will be discussing flat foot condition, also known as posterior tibial tendon insufficiency. First of all, let me start by saying that just because you have a flat foot doesn't necessarily mean that you have a problem. Many people have a completely asymptomatic flat foot deformity that doesn't really cause any pain, and these patients really do not necessarily need to seek any type of surgical intervention. What is a flat foot condition? The flat foot is when the arch of the foot starts to collapse. And this may be due to several causes. The most important and frequent cause is the insufficiency of a very important tendon called the posterior tibial tendon. Let me show you on a model of a foot. So this is a foot, okay? And this is the inside part of the ankle. The tendon starts at the back of the leg, comes all the way down, goes behind the inside part of the ankle bone, and attaches onto the foot. This tendon is extremely important because it helps maintain the arch. For reasons that are not fully clear, this tendon may start to lose strength or may start to lose elasticity. Imagine the elastic band of old underwear. It's still intact, but it has lost that elasticity and it can no longer hold up that underwear. It's a similar concept with the tendon insufficiency. This ultimately leads to a collapse of the arch, and in the most severe cases, it can also lead to a very concerning deformity of the ankle as well. Depending on how bad your deformity is, you will then be classified into a stage 1, 2, 3, and 4 flat foot deformity. What are the main things that you can start doing if you start developing symptoms from a flat foot deformity? First of all, you should see your orthopedic surgeon for an evaluation and to get weight-bearing x-rays. It's very important that you get the x-rays with you putting full weight on the foot, because that's the only way to actually assess the alignment of the bones. There are a few things that can be tried to mitigate the pain and resolve your discomfort. Physical therapy to strengthen this strained tendon is extremely important, and it's not just important to go to physical therapy, but you have to repeat those exercises at home on a daily basis. Another thing that helps tremendously are orthotics or some arch supports. Now, what's very important is finding the right support. It doesn't necessarily have to be custom made. And to be quite honest, even the custom-made orthotics, unless very specific things are specified when these orthotics are fabricated, they will not necessarily help you. So it needs some arch support, but it also needs some heel alignment. Why? Because when the foot starts to collapse, the heel bone starts to shift outside. So if you look, we're taking the model again, and we're looking at the back. This is the outside part of the ankle. This is the inside part of the ankle. What happens to the heel bone is that it starts to swing outside. And so we need to modify the orthotic so that it pushes the heel back straight. By pushing it back straight, it will offload that poor suffering tendon running on the inside part of the ankle. If patients don't respond to non-operative treatments, which in the most severe cases can also require a period of immobilization in a boot or even in a cast sometimes. And in certain cases, even instructing the patient to not put any weight on that foot for a limited amount of time, then surgery obviously becomes an option. There are different types of surgical procedures. For the most severe cases of flat foot deformity, which are known as rigid flat foot deformities, a fusion of the foot may be necessary. This procedure is called a triple arthrodesis. A rigid deformity is something that will have to be evaluated by an orthopedic surgeon on a physical examination. And this basically means, is the deformity passively correctable? Can we realign the bones without having to really stress them too much? If the answer is no, then the triple arthrodesis may be necessary. A triple arthrodesis, despite what many people fear, doesn't significantly affect your range of motion. You will still be able to move the ankle up and down. You will lose some of the side-to-side range of motion, which people that have a rigid flat foot have lost anyways. So you shouldn't be really noticing too much difference from that standpoint. The triple arthrodesis typically requires 6 weeks of non-weight bearing, followed by transitioning to weight bearing in a removable boot. Those patients that, on the other hand, have a flexible flat foot deformity, so it can be passively correctable by the surgeon, are candidates for a flat foot reconstruction surgery. This involves reconstructing the arch of the foot and realigning the heel bone. This can be done with a variety of techniques. My preferred technique is a minimally invasive to minimize the postoperative pain as well as the postoperative recovery, and then replacing that degenerated tendon that's no longer supporting the arch of the foot with a new tendon. This tendon is not a cadaver tendon, it's a tendon from your own ankle that we just move from one part of the foot to the other. These patients, depending on how many procedures are needed to realign the foot, are looking at a non-weight bearing period, which ranges from 2 to 6 weeks. And for these patients, physical therapy after surgery is actually extremely important because we have to teach the new tendon how to work again, and we need that tendon to become nice and strong. Most patients, whether it's a flat foot reconstruction or a triple arthrodesis fusion, will be able to return to sneakers or nice comfortable shoes by about 12 weeks after surgery. What are the risks of the procedure? Like any surgical procedure, any part of the body, there's always a possibility of complications. The vast majority of complications are mild and easily addressable. Others may require further surgical intervention. The most common complications, especially the less complicated ones, include swelling that normally lasts about 6 to 12 months in almost every patient, some temporary nerve irritation, superficial vein blood clots, sometimes deep vein blood clots, for which reason we usually put patients on some blood thinners after surgery. And then you can get some more complicated complications going from deep infections of the bone, or sometimes even the bones just not healing. And this may require even just giving the body more time to heal, or a second surgery to try to help those bones heal back together. Sometimes the tendon that you try to reconstruct fails again, and these patients may then need to be converted to the triple arthrodesis. And some patients, despite everything looking great on X-ray and clinically, are still having pain. And these patients may need, again, subsequent surgery. The success rate with flat foot reconstructions and the triple arthrodesis average around 90%. So it's a fairly successful procedure. But again, like any surgical procedure, don't believe it's a slam dunk. Do your research, but most importantly, rather than necessarily reading online, because sometimes it's hard to identify which sources of information are reliable and which are not, talk to your orthopedic surgeon. he or she will be able to explain your condition and explain what specific post-operative period you're looking at in your specific case, as well as the possible complications that you might encounter and be ready for. If, however, like the vast majority of patients, you heal well, you will be very, very happy with either the triple arthrodesis or the flat foot reconstruction, and will be able to return to a good lifestyle, including resuming most of the sport activities.